They laughed at the nurse's basic questions, until she started performing brain surgery. Dr. Marcus Thornfield didn't bother hiding his eye roll when the new nurse asked about the cranial pressure monitoring protocols. Sarah Martinez had been on the neurology ward for exactly 3 weeks, and her constant questions were beginning to irritate the surgical staff. "Just stick to bedpans and medications," he'd told her dismissively. Brain surgery requires years of specialized training. But when Senator Williams collapsed from a massive cerebral hemorrhage during his secret visit to Walter Reed, and the only available neurosurgeon was 3 hours away, the basic nurse, with too many questions, calmly stepped forward and asked for a scalpel. From which city in the world are you watching this video today? If you enjoy stories about hidden expertise and the moment competence reveals itself, please consider subscribing for more tales of extraordinary people in ordinary roles. Sarah Martinez adjusted her scrubs as she entered Walter Reed Medical Center for another night shift, her nurse's badge swaying slightly as she walked through the familiar corridors. To every colleague who passed her, she was exactly what she appeared to be, a competent but unremarkable registered nurse who'd transferred to the neurology ward 3 weeks ago from a smaller hospital in Maryland. Her questions about protocols and procedures had quickly earned her a reputation among the medical staff. Too curious for her own good, some said, asking about things that weren't really her concern. The attending physicians had grown tired of explaining complex neurosurgical procedures to someone they assumed lacked the education to truly understand them. What they didn't know was that Dr. Sarah Martinez had spent the last 8 years as one of the country's leading neurosurgeons, before everything changed. The transformation from acclaimed surgeon to anonymous nurse hadn't been voluntary. 18 months ago, Dr. Martinez had been the youngest department head in Johns Hopkins history, specializing in complex brain tumor removal and innovative surgical techniques. Her research on minimally invasive procedures had revolutionized treatment for previously inoperable conditions, and medical journals regularly featured her breakthrough techniques. She had been invited to speak at conferences in Geneva, consulted on cases from Tokyo to London, and was considered a leading candidate for the Nobel Prize in Medicine for her work on neural regeneration. At 34, she had achieved more than most surgeons accomplished in entire careers. Then came the Myanmar incident. What was supposed to be a humanitarian medical mission had turned into something else entirely when Dr. Martinez witnessed war crimes being committed by military personnel who were supposed to be protecting the medical convoy. Her decision to document the atrocities and report them to international authorities had made her a target of forces far more dangerous than medical malpractice lawyers. The death threats had started within weeks of her return to the United States. Her home was burglarized twice, her research was stolen, and colleagues began receiving warnings about associating with her. The message was clear: keep quiet about what you saw in Myanmar, or face consequences. When a car bomb exploded in her garage, missing her by minutes only because she'd been delayed at the hospital performing emergency surgery, the U.S. Marshals Service made the decision for her. Witness protection, complete identity change, a new life as far removed from her previous existence as possible. Sarah Martinez, RN, was born from the ashes of Dr. Martinez's former life. Same first name to reduce the chances of slip-ups, completely different background and credentials. A competent nurse with a steady work history and unremarkable references from hospitals that had been carefully selected to provide cover for her new identity. But erasing her identity couldn't erase her knowledge. 8 years of neurosurgical training and experience didn't simply vanish because her diploma now read nursing school instead of Harvard Medical School. Every day on the neurology ward was an exercise in restraint, watching procedures she could perform with her eyes closed while pretending to be impressed by basic medical techniques. Martinez called Dr. Thornfield as she passed the nurse's station. His tone carried the casual dismissiveness she'd grown accustomed to over the past 3 weeks. Room 314 needs his dressing changed, and try not to ask me 15 questions about wound healing this time. Sarah nodded professionally. Of course, Doctor. Marcus Thornfield was everything she'd once despised about academic medicine. Brilliant, arrogant, and completely convinced that expertise could only exist within the narrow boundaries of formal hierarchies. As the senior neurosurgeon on duty, he commanded respect through intimidation rather than inspiring it through leadership. 3 weeks of watching him work had been instructive. Thornfield was technically competent, but conservative in his approach, unwilling to attempt procedures that pushed boundaries or challenged conventional wisdom. He was exactly the kind of surgeon Sarah had once been determined never to become. The irony wasn't lost on her that she was now taking orders from someone whose surgical skills she surpassed in every measurable way. Room 314 housed a recovering craniotomy patient, a routine tumour removal that should have been straightforward. As Sarah examined the surgical site, she noticed subtle signs that concerned her. Slight swelling around the incision, discoloration that suggested possible infection, and drainage that wasn't quite the right consistency. In her previous life, these would have been immediate red flags requiring intervention. As a nurse, she was expected to document and report, not diagnose and treat. She approached Dr. Thornfield with her observations, carefully framing them as questions rather than assessments. "Doctor, I'm concerned about the healing progress in 314. The wound presents with indicators that might suggest—" "Martinez," Thornfield interrupted without looking up from his charts, "I've examined that patient twice today. The healing is proceeding normally. Perhaps you should focus on nursing duties and leave medical assessment to those qualified to make them." Sarah bit back her response. In her previous life, she would have insisted on immediate intervention, ordered additional tests, and probably saved the patient from a serious post-operative infection. As a nurse, her concerns were dismissed without consideration. "Of course, doctor. Should I continue monitoring and report any changes?" "Do whatever the nursing protocols require," Thornfield replied dismissively. "Just try to avoid bothering me with every minor observation." It was nearly midnight when everything changed. Sarah was updating patient charts when the elevator doors opened to reveal a sight that made her pulse quicken. Secret Service agents in dark suits, moving with the practiced efficiency of people accustomed to protecting high-value targets. Their earpieces were visible despite attempts at concealment, and their suits bore the subtle bulges that indicated concealed weapons. Behind them walked a figure she recognized immediately from news coverage, Senator Robert Williams, chairman of the Senate Intelligence Committee. At 68, Williams was one of the most powerful men in Washington, with oversight authority over the intelligence community and access to the nation's most classified secrets. The senator's presence at Walter Reed, unannounced and under heavy security, could only mean one thing: a medical emergency significant enough to require the highest level of discretion. Politicians didn't make midnight visits to military hospitals unless something was seriously wrong. Sarah watched from her position at the nurses' station as the entourage moved quickly toward the executive medical suite, a section of the hospital reserved for government officials and other VIPs requiring secure treatment. Dr. Thornfield appeared from the break room, hastily summoned to attend whatever crisis had brought one of the country's most powerful politicians to the hospital in the middle of the night. 20 minutes later, alarms began ringing throughout the neurology ward. The code blue announcement echoed through the corridors. "Code blue, executive suite. Code blue, executive suite. All available medical personnel respond immediately." Sarah's training kicked in despite her official limitations. She ran toward the commotion, arriving at the executive suite to find controlled chaos. Senator Williams was on the floor, unconscious, while Dr. Thornfield and 2 other physicians worked frantically to stabilize him. "Massive cerebral hemorrhage," Thornfield was saying into his phone, sweat beading on his forehead despite the air conditioning. "We need a neurosurgeon immediately. What do you mean the nearest available surgeon is 3 hours away?" Sarah assessed the situation from the doorway, with eyes trained to recognize critical neurological emergencies. Senator Williams was unconscious, his pupils dilated and unresponsive to light. The monitors showed rapidly increasing intracranial pressure, a condition that would cause irreversible brain damage or death if not addressed immediately. She could see the classic signs: the posturing of his limbs, the abnormal breathing pattern, the way his vitals were beginning to deteriorate in a pattern she'd witnessed dozens of times before. Even without advanced imaging, her experience told her this was a catastrophic bleed that required immediate surgical intervention. Not in 3 hours. Not in 1 hour. Now. "Doctor," she said quietly, stepping into the room. "Martinez, get out of here," Thornfield snapped, his composure beginning to crack under pressure. "This is way above your level." Sarah ignored him, moving closer to examine the patient. The signs were unmistakable to someone with her background, a massive hemorrhage in the brain that required immediate surgical decompression. Every minute of delay increased the likelihood of permanent damage or death. "His intracranial pressure is rising rapidly," she observed, noting the subtle changes in his neurological responses. "Without immediate decompression, he'll herniate within the hour." Dr. Thornfield turned to stare at her, confusion replacing irritation. "How do you know about brain herniation?" Sarah met his gaze steadily, weighing her options. Maintaining her cover might mean watching a patient die from a condition she could treat. Breaking cover would expose her to the dangers she'd fled, but might save a life. "Because I can perform the surgery he needs." The room fell silent except for the urgent beeping of monitors. Secret Service agents, medical staff, and Dr. Thornfield all stared at the nurse who had just claimed she could perform neurosurgery. "Martinez, this is not the time for—" "Doctor," Sarah interrupted, her voice carrying an authority that hadn't been there moments before. "I need you to listen very carefully. Senator Williams has approximately 40 minutes before this hemorrhage causes irreversible brain damage. The procedure he needs is a craniotomy with evacuation of the hematoma. I have performed this exact surgery over 200 times. Dr. Thornfield's face went pale. "That's impossible. You're a nurse." Sarah turned to the senior Secret Service agent, Agent Reynolds, whose hand had moved instinctively toward his weapon at the unexpected development. "Sir, you can verify my credentials through the U.S. Marshals Service, authentication code Lazarus 7. But right now, you need to decide whether you want to trust the nurse who can save the senator's life, or wait for a surgeon who won't arrive in time." Agent Reynolds spoke quickly into his radio, his face grim as he received confirmation of something that made no sense according to everything he thought he knew about hospital personnel clearance. "Dr. Sarah Martinez, former department head of neurosurgery, Johns Hopkins Medical Center, currently under federal protection." Dr. Thornfield staggered backward as if physically struck. "You're Dr. Martinez? The Dr. Martinez who developed the minimally invasive tumor protocols? The one who revolutionized temporal lobe surgery?" "We can discuss my resume later," Sarah replied, already moving toward the surgical prep area with the efficiency of someone who had performed this routine hundreds of times. "Right now, I need an OR prepared for emergency craniotomy. And doctor, I'll need your assistance if you're willing to follow the lead of a basic nurse with too many questions." The transformation was immediate and striking. Sarah's entire demeanor shifted from deferential nurse to commanding surgeon. Her movements became precise and purposeful. Her voice carried the authority of someone accustomed to making life-and-death decisions, and her assessment of the patient demonstrated expertise that left no doubt about her qualifications. "I need the OR prepped for emergency craniotomy," she told the head nurse, who had appeared at the first sound of the code blue. "Standard neurosurgical setup, but I want the Zeiss microscope available and high-speed drill ready. Get me 2 units of O-negative blood on standby." "Doctor," Agent Reynolds interjected, "the senator's security clearance requires." "Agent Reynolds, I don't care if he's the president himself," Sarah replied firmly. "Right now he's a patient with a medical emergency that will kill him if we waste time on protocol. You can have your security briefing after I've saved his life." Dr. Thornfield found his voice. "Dr. Martinez, Sarah, I don't understand. How did you end up working as a nurse? Your research, your reputation, you were considered one of the best neurosurgeons in the world." "Long story," Sarah replied tersely as they moved toward the OR. "The short version is that sometimes standing up for what's right puts a target on your back. The Marshals Service decided Dr. Martinez needed to disappear for her own safety." The operating room at Walter Reed was state-of-the-art, equipped with technology that rivaled the best civilian hospitals. As Sarah scrubbed in, muscle memory took over. Her hands moved with practiced precision, performing the ritual she'd completed thousands of times during her surgical career. "Dr. Thornfield," she said as they prepped, "I know this is unusual, but I need you to trust me. The senator's life depends on it." "After 3 weeks of watching you ask basic questions about wound care, this is quite an adjustment," Thornfield admitted. "But your credentials check out, and frankly, you're his only chance." Sarah smiled grimly. "Those weren't basic questions, Doctor. They were quality assessments. I've been evaluating this facility's protocols and procedures. Old habits die hard." The surgery that followed would never appear in any medical journal. Officially, Senator Williams underwent an emergency procedure performed by the senior neurosurgeon on duty, assisted by nursing staff. The fact that a woman in witness protection had saved the life of one of the country's most powerful politicians remained classified at the highest levels. Sarah's hands moved with practiced precision as she opened the senator's skull, relieving the pressure that was threatening his life. The hemorrhage was extensive but manageable for someone with her experience. She worked with a focused intensity that had made her famous in surgical circles, her movements economical and precise. "Suction here," she instructed Dr. Thornfield, who was assisting with the dedication of someone witnessing a master at work. "Can you see the bleeding vessel? There at the posterior temporal." "Amazing," Thornfield murmured as Sarah controlled the hemorrhage with techniques he'd only read about in journals. "Your approach is completely different from what I learned in residency." "I developed most of these techniques myself," Sarah replied, not boasting but simply stating fact. "The traditional approach works, but this minimizes trauma to surrounding tissue." 2 hours later, Senator Williams was stable, the hemorrhage controlled, and the pressure on his brain relieved. He would make a full recovery with no lasting neurological damage, thanks to surgical intervention that had arrived just in time. As they closed the incision, Dr. Thornfield shook his head in amazement. "I've never seen surgery performed with that level of precision. The way you handled the approach, the bleeding control, the tissue preservation, it was like watching an artist." Sarah began removing her surgical gloves. "It's just experience, Doctor, and the fact that I've been thinking about this case for 3 weeks." "What do you mean?" "The patient in 314 that I tried to tell you about. He's developing exactly the kind of post-operative infection I warned you about 3 weeks ago. The signs were there, but you weren't interested in the observations of a basic nurse." Dr. Thornfield's face reddened. "You're right, I owe you an apology, and not just about the patient in 314. Agent Reynolds met them as they left the OR. Dr. Martinez, I need to understand what just happened here. According to our records, you're supposed to be a nurse under federal protection." "I am under federal protection," Sarah replied. "The nursing credentials are part of my cover, but surgical skills don't disappear because your identity changes. The senator's going to want to thank you personally when he recovers." "No," Sarah said firmly. "Officially, this surgery was performed by Dr. Thornfield with assistance from nursing staff. My involvement doesn't appear in any records." "But, Agent Reynolds, the people who tried to kill me 18 months ago are still out there. The senator's gratitude won't protect me if my location is compromised. As far as anyone knows, I'm just a nurse who happened to be in the right place at the right time." Dr. Thornfield stepped forward. "Dr. Martinez, this is incredible. Having someone with your expertise working in our facility, even undercover, we could learn so much." Sarah considered this. "What are you proposing?" "Stay. Keep your nursing cover, but let me know who you really are. I could create consulting opportunities, research projects that don't require your real name but use your expertise. And my safety. We'll work within your protection requirements, but the medical community needs your knowledge, even if they can't know who's providing it." Sarah thought about the patient in room 314, about the procedures she'd watched over the past 3 weeks that could have been improved, about the research she'd abandoned when her life was threatened. "I'll consider it," she said finally. "But first, we need to check on the patient in 314. I believe he's going to need antibiotic intervention within the next 6 hours." 3 weeks later, Sarah Martinez continued her work as a nurse on the neurology ward, asking questions that seemed too advanced for her position. But now, when she made suggestions about patient care, the medical staff listened with the respect due to someone whose knowledge had proven itself when it mattered most. Dr. Thornfield never again dismissed a question from nursing staff. In fact, he personally recommended Sarah for a promotion to head of neurosurgical nursing, a position that would allow her to use more of her expertise while maintaining her protective cover. The patient in room 314 made a full recovery after Sarah's intervention prevented a serious infection. Senator Williams returned to his duties with no memory of the night his life had been saved by a nurse whose real identity remained classified. And in the medical journals that Sarah could no longer publish under her own name, new techniques began appearing credited to anonymous surgical consultants whose innovations continued to advance the field of neurosurgery. Sometimes the most dangerous thing you can do is underestimate the person asking basic questions. They might know more than you think, and sometimes the most important work happens when no one knows who's really doing it. Have you ever been surprised by someone's hidden expertise when you least expected it? Share your story in the comments below and subscribe for more tales of extraordinary competence hiding in ordinary roles.